Hello, everybody. We hope that you are having a great day. We are here with video on a topic that was requested by one of our subscribers, and that is anatomical terminologies. Healthcare providers use vocabulary that can be confusing to the amateurs. Nevertheless, the aim of this language is not to complicate, but to improve accuracy and minimize medical errors. For instance, is a scar above the wrist, located on the forearm, 2 or 3 inches away from the hand? Or, is it at the base of the hand? Is it on the palm side or back side? By using specific anatomical terminology, we can eradicate vagueness. Anatomical terms are derived from ancient Greek and Latin words. Since these languages are no longer used in daily dialogue, the meaning of their words does not change. Anatomical terms are made up of roots, prefixes, and suffixes. The root of a term often describes an organ, tissue, or condition, whereas the prefix or suffix often explains the root. Such as, in the disorder hypertension, the prefix hyper implies high or over, and the root word tension describes pressure. So the word hypertension indicates abnormally high blood pressure. In this video, we will discover some anatomical terminologies. Learn these terms to memory to avoid any confusion while studying or describing the locations of particular body parts. By the end of this video, you will be able to elucidate the anatomical, prone and supine positions. Explain the human body, using regional and directional terms. Define some dental anatomical terms, as well as anatomical terms of laterality. Pinpoint 3 most used body planes and axes of rotation in the study of anatomy. Illustrate the anatomical terms of movement. Describe body cavities. Make distinctions between abdominal quadrants and regions. Let's start off. To enhance precision, anatomists systematize the way in which body is viewed, just like maps, which are normally oriented with north at the top. Anatomical position is that position of the body, standing upright, with the feet at shoulder width and parallel, toes forward. The upper limbs are held out to each side and the palms of the hands face forward as shown in this figure. Using this standard position lessens misunderstanding. What are prone and supine positions? Let's discuss. The prone position is a body position in which the person lies flat, with the chest down and the back up. On the other hand, the supine position means lying horizontally with the face and torso facing up. The supine position is the 180 degrees contrast. Here are the diagrams for comparison between these two positions. Upcoming are regional terms. The various regions of human body have certain terms to increase precision. These anatomical regions compartmentalize the human body. The body is divided into 2 major portions, axial and appendicular. We will learn the names of the axial and appendicular body's main regions in succession. The axial body runs right down the center or axis and consists of everything except the limbs, meaning the head, neck, thorax including chest and back, abdomen and pelvis. The main regions of axial body include head and neck. It involves cephalic, relating to head; cervical, relating to neck; cranial, relating to skull; frontal, relating to forehead; nasal, relating to nose; occipital, relating to base of skull; oral, relating to mouth, and orbital or ocular, relating to eyes. Thorax. It incorporates axillary, relating to armpit; costal, relating to ribs; deltoid, relating to shoulder; mammary, relating to breast; pectoral, relating to chest; scapular, relating to shoulder blade; sternal, relating to breastbone, and vertebral, relating to backbone. Abdomen. It embraces abdominal, relating to abdomen; gluteal, relating to buttocks; inguinal, relating to bend of hip; lumbar, relating to lower back; pelvic, relating to area between hip bones; perineal, relating to area between anus and external genitalia; pubic, relating to genitals, and sacral, relating to endovertebral column. The appendicular body consists of appendages, also known as upper and lower extremities, which you call arms and legs. The main regions of appendicular body include upper extremity. It contains antebrachial, refers to forearm; antecubital, refers to inner elbow; brachial, refers to upper arm; carpal, refers to wrist; cubital, refers to elbow; digital, refers to fingers or toes; manual, refers to hand, and palmar, refers to palm. Lower extremity. It includes crural, refers to shin, front of lower leg; femoral, refers to thigh; patellar, refers to front of knee; pedal, refers to foot; plantar, refers to arch of foot; popliteal, refers to back of knee; sural, refers to calf, back of lower leg, and tarsal, refers to ankle. This figure shows the difference between the two regional divisions of the body. Next, we will talk about the directional terms. Certain directional anatomical terms are used for describing the relative locations of different body structures. We will discuss them one by one. Anterior or ventral. It describes the front or direction toward the front of the body. For example, the toes are anterior to the foot. Posterior or dorsal. It describes the back or direction toward the back of the body. For example, the popliteus is posterior to the patella. Superior or cranial. It describes a position above or higher than another part of the body. For example, the orbits are superior to the oris. Inferior or caudal. It describes a position below or lower than another part of the body proper, nearer toward the tail, in humans, the coccyx, or lowest part of the spinal column. For example, the pelvis is inferior to the abdomen. Lateral. It describes the side or direction toward the side of the body. For example, the thumb, pollex, is lateral to the digits. Medial. It describes the middle or direction toward the middle of the body. For example, the hallux is the medial toe. Proximal. It describes a position in a limb that is nearer to the point of attachment or the trunk of the body. For example, the brachium is proximal to the antebrachium. Distal. It describes a position in a limb that is farther from the point of attachment or the trunk of the body. For example, the crus is distal to the femur. Superficial. It describes a position closer to the surface of the body. For example, the skin is superficial to the bones. Deep. It describes a position farther from the surface of the body. For example, the brain is deep to the skull. There are some other older or traditional terms, which are still in use today. Some of these are particularly relevant in embryology and include cephalad, meaning towards the head, also known as craniad. Rostral, meaning anterior, used in brain development. Volar or palmar, meaning anterior, used in relation to the hand. Plantar, meaning sole of the foot. Radial, meaning radial aspect of the forearm. Ulnar, meaning ulnar aspect of the forearm. Tibial, meaning tibial aspect of the anatomical leg. Fibular, meaning fibular aspect of the anatomical leg. Internal, meaning medial aspect of the body, for example, internal carotid artery. External, meaning lateral aspect of the body, for example, external carotid artery. This figure explains the already reviewed directional terms. Now, we will learn some dental anatomical terms. Mesial or distal refers to medial and lateral with regards to any tooth. Buccal refers to anterior surface of the tooth, the surface facing the cheek. Palatal refers to posterior surface of a maxillary tooth, the surface facing the inside of the mouth. Lingual refers to posterior surface of a mandibular tooth, the surface facing the inside of the mouth. Facial refers to towards the lips or cheek. Gingival, concerned with the gums. Next, we will share the anatomical terms of laterality. Unilateral, meaning one side of the body. For example, a stroke can result in unilateral weakness, meaning weakness on one side of the body. Bilateral, meaning both sides of the body. For example, bilateral orchiectomy means removal of testes on both sides of the body. Ipsilateral, meaning on the same side of the body. For example, the right arm is ipsilateral to the right leg. Contralateral, meaning on the opposite side of the body. For example, the left arm is contralateral to the right leg. Left and right are used to differentiate between paired body parts. What are different body planes? Let's discuss. A body plane is an imaginary, two-dimensional surface that passes through the body. There are three planes, commonly referred to in anatomy and medicine, as demonstrated in the figure. We will discuss them one by one. First one is transverse or horizontal plane. It divides the body or organ horizontally into upper and lower portions. Transverse planes produce images, referred to as cross-sections. Second one is frontal plane. It divides the body or an organ into an anterior or front portion and a posterior or rear portion. The frontal plane is often referred to as a coronal plane. Corona is Latin word for crown. Third one is sagittal plane. It divides the body or an organ vertically into right and left sides. If this vertical plane runs directly down the middle of the body, it is called the mid-sagittal or median plane. If it divides the body into unequal right and left sides, it is called a parasagittal plane, or less commonly a longitudinal section. The human body is also divided into anatomical axes. Axis of rotation is an imaginary line that passes through a joint or the body to describe the movement. There are three primary axes of rotation. This diagram demonstrates three of them. We will discuss them one by one. Horizontal or mediolateral axis runs from side to side. It is perpendicular to sagittal plane. It typically produces flexion and extension. Longitudinal or vertical axis runs straight through the top of the head, down between the feet. It is perpendicular to the transverse plane. It typically produces a rotation type of movement. Anteroposterior or sagittal axis runs from front to back. It is perpendicular to the coronal plane. It typically produces abduction and adduction movements. Upcoming are anatomical terms of movement. Movement of parts of the body is described in relation to the anatomical position. They occur in opposing pairs and include flexion, decrease in the angle of the joint; extension, increase in the angle of the joint. This figure shows the flexion and extension of knee joint. Abduction, movement of limb away from midline; adduction, movement of limb towards the midline. This figure illustrates the abduction and adduction movements. Pronation, movement of hand and forearm to bring the palm facing posterior; supination, movement of hand and forearm to bring the palm facing anterior. This figure demonstrates pronation and supination movements. Circumduction, circular movement of a joint, using a combination of flexion, abduction, extension, and adduction such that the distal limb describes a circle. This figure shows circumduction movement. Medial or internal rotation, rotational motion of a limb medially. Lateral or external rotation, rotational motion of a limb laterally. This figure illustrates the medial and lateral rotations. Ulnar deviation, medial movement of the wrist towards the midline. Radial deviation, lateral movement of the wrist away from the midline. This figure demonstrates ulnar and radial deviation. Opposition, thumb brought to oppose another digit. Reposition, thumb repositioned back to the anatomical position. This figure shows the opposition and reposition of thumb. Elevation, movement of the scapula superiorly. Depression, movement of the scapula inferiorly. This figure shows the elevation and depression of scapula. Version, degree of forward or backward tilt, that is anteversion and retroversion, respectively. It is used with these anatomical structures. In around 75% of women, the uterus is anteverted, that is tilted forward. In the remaining 25%, it is retroverted, that is, tilted backward. The difference, in angles, between femoral neck axis and transcondylar axis of knee. Regarding the femoral neck, the terms anteversion and retroversion are used for describing pathological tilt, usually of developmental etiology. Aversion, movement of the sole of the foot, away from the median plane. Inversion, movement of the sole of the foot, towards the median plane. This figure shows the aversion and inversion movements. Protrusion, movement of the mandible, lips or tongue anteriorly. Retraction or retrusion, movement of the mandible, lips or tongue posteriorly. This figure shows the protrusion and retrusion of mandible. Upcoming are body cavities. The body maintains its internal organization by means of membranes, sheaths, and other structures that separate compartments. The major cavities of the human body are the spaces left over when internal organs are removed. The main cavities of the body include cranial cavity. It is the space occupied by the brain, enclosed by the skull bones. Spinal cavity. It is the space occupied by the spinal cord, enclosed by the vertebrae column, making up the backbone. The spinal cavity is continuous with the cranial cavity. Dorsal body cavity. It includes the cranial cavity and the spinal cavity in combination. Thoracic cavity. It is the space occupied by the ventral internal organs, superior to the diaphragm. It is enclosed by the rib cage and contains the lungs and the heart, which is located in the mediastinum. Abdominal cavity. It is the space occupied by the ventral internal organs, inferior to the diaphragm, and superior to the pelvic cavity. Pelvic cavity. It is the space occupied by the ventral internal organs that are bordered by the bones of the pelvic girdle. Abdominopelvic or peritoneal cavity. It is the largest cavity in the body. It includes the abdominal cavity and the pelvic cavity in combination. Although no membrane physically divides the abdominopelvic cavity, it can be useful to distinguish between the abdominal cavity, the division that houses the digestive organs, and the pelvic cavity, the division that houses the organs of reproduction. The diaphragm forms the floor of the thoracic cavity and separates it from the more inferior abdominopelvic or peritoneal cavity. Ventral body cavity. It includes the thoracic cavity, the abdominal cavity, and the pelvic cavity in combination. This diagram explains all the cavities, which we have already discussed. There are other body cavities, which are created by serous membranes. Each serous membrane is composed of a secretory epithelial layer and a connective tissue layer underneath. The body cavities, formed by serous membranes include the pleural cavities, surrounding the lungs, the pericardial cavity, surrounding the heart, the peritoneal cavity, which we have already discussed, and the mediastinum, the division of the thoracic cavity, containing the heart, thymus gland, portions of the esophagus, and trachea, and other structures. Let's discuss the abdominal quadrants and regions in detail. Anatomists and medical personnel split up the abdominopelvic cavity into smaller regions to help study and discussion. These divisions are often used to compartmentalize the individual abdominal organs by their location and function. They are used by clinicians to diagnose the source of abdominal pain and ascertain correct treatment. The abdominopelvic cavity can be subdivided into 4 quadrants and 9 areas. We will discuss them in succession. The abdominopelvic region can be divided into 4 quadrants. These quadrants are defined by the intersection of the sagittal plane with the umbilical plane, the transverse plane through the navel, and are categorized by location. They include the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. Let's discuss them one by one. The right upper quadrant contains the right portion of the liver, the gallbladder, right kidney, a small portion of the stomach, the duodenum, the head of the pancreas, portions of the ascending and transverse colon, and parts of small intestine. Pain in this region is associated with infection, and inflammation in the gallbladder and liver or peptic ulcers in the stomach. The left upper quadrant is the location of the left portion of the liver, part of the stomach, the pancreas, left kidney, spleen, portions of the transverse and descending colon, and parts of the small intestine. Pain in this region is associated with malrotation of the intestine and colon. In the right lower quadrant sits the cecum, appendix, part of the small intestines, the right half of the female reproductive system, and the right ureter. Pain in this region is most commonly associated with appendicitis. The left lower quadrant houses the majority of the small intestine, some of the large intestine, the left half of the female reproductive system, and the left ureter. Pain in this region is generally associated with colitis, inflammation of the large intestine, as well as pelvic inflammatory disease, and ovarian cysts in females. Abdominal divisions is an alternate system for dividing the abdominopelvic cavity into regions. These 9 divisions of the abdominopelvic region are smaller than the 4 quadrants, allowing for a more detailed discussion. These divisions are marked by 2 parasagittal and 2 transverse planes centered around the navel. Most organs are part of multiple regions, including the gallbladder, duodenum, stomach, kidneys, spleen, small intestine, and colon. The perineum, the area beneath the hypogastric region, at the bottom of the pelvic cavity, is sometimes considered to be a 10th division in this system. Abdominal divisions include right hypochondriac region, left hypochondriac region, epigastric region, right lumbar region, left lumbar region, umbilical region, right iliac region, left iliac region, and hypogastric region. Let's learn. The right hypochondriac region contains the right portion of the liver, the gallbladder, the right kidney, and parts of the small intestine. The left hypochondriac region contains part of the spleen, the left kidney, part of the stomach, the pancreas, and parts of the colon. The epigastric region contains the majority of the stomach, part of the liver, part of the pancreas, part of the duodenum, part of the spleen, and the adrenal glands. This region pushes out when the diaphragm contracts during breathing. The right lumbar region consists of the gallbladder, the left kidney, part of the liver, and the ascending colon. The left lumbar region consists of the descending colon, the left kidney, and part of the spleen. The umbilical region contains the umbilicus, that is, navel, and many parts of the small intestine, such as part of the duodenum, the jejunum, and the ileum. It also contains the transverse colon, the section between the ascending and descending colons, and the bottom portions of both the left and right kidney. The right iliac region contains the appendix, cecum, and the right iliac fossa. It is also commonly referred to as the right inguinal region. Pain in this area is generally associated with appendicitis. The left iliac region contains part of the descending colon, the sigmoid colon, and the left iliac fossa. It is also commonly called the left inguinal region. The hypogastric region contains the organs around the pubic bone. These include bladder, part of the sigmoid colon, the anus, and many organs of the reproductive system, such as the uterus and ovaries in females, and the prostate in males. The aim of the abdominal divisions is to define regional anatomy in the abdomen, and to help out clinicians ascertain which organ and tissues are involved in a disease, based on which regions experience pain. Here we reach the finish line. Understanding these terms will help you to have a shared method of communication with doctors and technicians. It will also help you to avoid confusion while pinpointing structures and describing locations. Knowing these terms will definitely make things clear for you and save your time. Thank you.